Hi, let's talk about female infertility investigation. When a woman presents to an infertility clinic, the first consultation is an opportunity to know about her medical history and carry out a fertility assessment. The result of this assessment helps with the preparation of a personalized fertility treatment plan that addresses the woman's wishes and aspirations of having a healthy baby. An assessment of ovarian reserve is carried out as one of the tests. This test is done to assess the quality and quantity of eggs in the woman's ovaries. A woman needs a good amount of high-quality eggs to get pregnant. Both the quality and quantity of eggs begin to reduce rapidly after the age of 35. Different tests to assess the ovarian reserve includes number 1, the AMH, also called the anti-mullerian hormone. This is a hormone present in women of reproductive age that gives us an idea of the number of follicles in a woman's ovaries and the chances of a pregnancy occurring in her. The test can be carried out at any time of the woman's cycle and involves just a blood sample. Normal values for this test are values from 1 to 4 nanogram per ml. It gives an idea that the woman can get pregnant. When the values are reduced at less than 1 nanogram per ml, it shows that there are challenges with the woman getting pregnant, and elevated values above 4 nanogram per ml points to the risk of polycystic ovaries. A hormonal profile can also be carried out. This is a blood test taken on the 3rd day of the menses of the woman. It assesses for tests like the follicle-stimulating hormone, which is the FSH, and estradiol levels. An elevated FSH level, which is the follicle-stimulating hormone, indicates a reduction in the number of eggs in the woman. An elevation also in prolactin levels also indicates hyperprolactinemia, which needs to be treated. The antral follicular count, or the AFC, can also be carried out. This is carried out by a doctor by performing a transvaginal scan on the first 3 days of the menstrual cycle of the woman. The procedure checks for the number of follicles available just after the menses. It gives an idea of the fertility potential of the woman. Between 6 and 10 follicles per ovary are considered normal. If the follicles are less than 6, the ovarian reserve is considered low and the chances of pregnancy occurring reduces. These follicles usually vary in size from 2 to 10 millimeters. Another assessment that needs to be done apart from the assessment of the ovarian reserve is the assessment of the fallopian tubes to check if it is patent or if the fallopian tubes are open. These tests are done to determine the patency of the tubes and the status of the uterine cavity to ensure the fertilized eggs can implant in the cavity and thrive. A woman must have one or both fallopian tubes patent for the sperm to reach the eggs after intercourse. If both tubes are blocked, pregnancy will not occur naturally. The popular test done to assess this is a hysterosalpingogram, or HSG. This is an X-ray test in which a dye is injected into the tube to outline the endometrial cavity and the fallopian tube. The test is carried out within the first 5 days after the menses. A less painful test called the saline hysterogram can also be carried out. It's an imaging study of the uterus using a transvaginal scan to view the fallopian tube and the uterine cavity while inserting fluid into the uterus via the cervix. It picks up conditions like endometrial polyps and endometrial fibroids. A laparoscopy and dye test can also be carried out. This is an operative procedure to look at a woman's internal organ, usually the fallopian tube, using a telescope and a monitor. A blue dye is pushed through the vagina and the fallopian tube to check if the fluid flowing out through the other side of the tube. It is usually the gold standard test for checking if the fallopian tubes are patent.